Hello and welcome to Talk Trillium, Partnering for Patients. My name is Patty Cochran, Senior Vice President, Clinical Strategy and Chief Innovation Officer at Trillium Health Partners, which includes the Credit Valley Hospital, Mississauga Hospital, and the Queensway Health Centre. I'll be your host as we take a look at how our hospital is working to create a new kind of healthcare for a healthier community. Today we're going to talk about how to keep your brain healthy as you age. And I'm so pleased to welcome Dr. Barbara Clive, Division Head of Geriatrics at Trillium Health Partners, and Mary Lynn Peters, Advanced Nurse Practitioner at Trillium and Board Chair of the Alzheimer's Society of Peel. So Barbara, I'm going to ask you a personal question first. This morning I got up and I was so excited to come today, but I forgot to do something, so I ran upstairs to my bedroom, and when I got there, I forgot what I had to do. Is that normal? I'm worried about myself a little bit.
So don't worry, Patty.
Good.
So one of my jobs as a geriatrician is to help people understand the difference between normal brain aging and abnormal brain aging or dementia. And the brain changes a lot as we age. One of the things, our reaction times are slowed, our intellectual and physical processing is slowed. We do have some changes in language as well. Although our vocabulary is pretty well preserved, we start to take on a little bit more of a narrative pattern, and I'm sure you've had some seniors who like to tell stories.
Oh yes.
That's all part
so
of normal
true.
aging.
Yes.
Now we have some changes in our memory as well. Although we are quite good at storing things in our memory, our retrieval of those things is not quite so good. So you might have noticed that a little trouble remembering people's names, places, and we also aren't so good at multitasking. So when you're running upstairs, you're thinking of something else and you've forgotten what you went up there for. We know that when our teenagers are doing their homework, they seem to be able to watch television, listen to music, and talk to a friend on the phone.
Isn't that amazing?
Isn't that amazing?
Yes.
And I have to turn off the radio to read the newspaper. So that ability to multitask goes down as well. We also notice as we get older that we have a little bit of an accentuation of some of our underlying personality traits. We tend to be a little less flexible, a little less risk-taking, and we like our routines a lot more than we used to. So don't worry if you've forgotten your keys or you can't remember someone's name. You should worry if these things are starting to interfere with your daily life. So you're unsafe. You're putting pots on the stove and forgetting them and have a whole set of burned pots. You're lost when you're driving. These are things you need to worry about. But I wouldn't worry about what happened this morning.
To know. Very reassuring, and so thank you. So Mary Lynn, I'm going to ask you a question. How can individuals keep their minds active? What should they do? And does that help in the aging process?
Absolutely, absolutely. One of the biggest things to do is to stay physically active. There's a very strong connection between the mind and the body. And so a healthy mind is a reflection of a healthy body. So physical activity 3 times a week has been shown to reduce your risk of dementia by upwards of 30%.
30%.
Staying physically active is very important in that. Things like staying socially engaged, getting out of the house as much as you can. Watching TV doesn't count. So visiting with friends, joining a bridge club, going for walks, all of those things that seem very common sense and not exactly high-tech or fancy make a big difference for keeping your brain active and healthy.
And I guess the difference between watching television, for instance, and going out is really having a two-way conversation.
Yes.
It kind of makes your brain continue to think and being able to respond appropriately.
Absolutely. It's the engagement, that interaction that's key. And learning new things, too, is very important.
And what are some of the programs available for seniors at Trillium?
We have several programs. There are fall prevention programs. There are 3 levels now, right? We're just introducing our 3rd level. We have strong and steady, stronger and steadier, and help me with our 3rd one.
Well, stronger and steadier 1 and 2.
There we are. We were creative with the names. So we have the 3 fall prevention programs. We have continence programs to help people because sometimes as people age, they have issues with their controlling their bowels and bladder. So we have continence programs to help people regain that function and independence. We have outreach programs for people who aren't able to come to the clinics, outreach in mental health and physical health programs.
Outreach meaning you go to their home?
We do. We have teams with physicians, social workers, nurse practitioners, pharmacists, physiotherapists
Excellent.
that go to people's homes depending on what their needs are.
Thank you so much for joining us today, Barbara and Mary Lynn. We appreciate you taking the time to educate us about keeping your brain healthy through social engagement. Thank you.
Thanks for inviting us.
Yes.
Thank you.
The Hospital Elder Life Program, or HELP, is designed to help older patients who are admitted to the hospital stay mentally and physically active during their hospital stay. This helps to prevent delirium and functional decline. When a patient 70 or older is admitted to the hospital, they receive a screening from the Elder Life specialist to determine their risk for delirium and functional decline. Some of the things that may impact an individual's risk for delirium and functional decline are poor cognition, mobility problems, problems with activities of daily living, vision and hearing problems, sleep problems, and communication problems. Delirium is a sudden and temporary onset of confusion. The symptoms of delirium fluctuate, meaning that they can change throughout the course of the day. It's different than dementia or Alzheimer's disease because the symptoms come on quickly and often clear up completely. Delirium is a serious medical condition and is sometimes the only clue that there is a more serious underlying medical condition. There are many symptoms of delirium. Sometimes patients appear very confused. They might have difficulty paying attention and concentrating. There may be sleep difficulties, either sleeping too much during the day or getting their days and nights mixed up so that they're sleeping in the daytime and not sleeping at nighttime. Patients sometimes become upset and restless. They may have problems in terms of hearing and seeing things that are not there. There are many different risk factors for delirium. Things like having a pre-existing memory or thinking problem can put you at greater risk for delirium, as well as having a severe illness, which meant you had to have a prolonged stay in the hospital. If you're not eating or drinking well, you're at greater risk for developing a delirium. If you've had a recent surgery, and if you have hearing and vision problems, all of these things can put you at greater risk for developing delirium. Functional decline is a general weakness or inability to perform basic activities of daily living, things like walking, bathing, dressing, grooming, and feeding oneself. Staying in bed too long or remaining inactive can cause muscle weakness, decreased balance, exhaustion, and even falls. Studies have shown that functional decline can happen within 2 days of hospital admission. It can take a long time to regain strength, endurance, and mobility once lost. Older patients are at greater risk of staying in hospital longer or not being able to return to their home environment because of functional decline. As part of the baseline assessment, the patient participates in a functional assessment, a cognitive screen, and a delirium screen. Information about routine daily practices and living habits of the patient are obtained, along with vision and hearing information, information about their mobility, information about sleep, nutrition, and their leisure and any hobbies that they're interested in. This information is used to create a specialized, unique care plan for the patient with input from the patient. Appropriate interventions are then carried out by the specially trained HELP volunteers. Volunteers do such things as providing an exercise program for the patients, encouraging intake at mealtime, encouraging hydration, and helping patients participate in leisure activities while they're in the hospital. Volunteers are available typically 7 days a week from 8 a.m. to 8 p.m.
My name is Bonnie Beard, and I'm a nurse practitioner at Trillium Health Partners in the Senior Services Program. I was born in Toronto, and I went to school at Centennial College, where I obtained my registered nurse diploma, and then I got married and moved to Mississauga and had 3 children. So I'm the nurse practitioner in the seniors program. I just wanted to chat a bit about your mom, Betty. It's a specialized geriatric area that has clinics, outreach, falls program, and continence, and it's funded by the Mississauga Halton Lynn. So I am a nurse practitioner in the clinics and in the outreach, and I see people in their home and in clinic appointments. Is she sleeping any better? So I started at Credit Valley in 1988, right out of nursing school, and then the last 15 years I spent in the emergency department. There were some very busy days there, and I was coordinating nurse most of the time, and a lot of seniors come through our emergency department, which allowed me to see that I wanted to do more for the senior population, and that led me back to school in 2007. So a nurse practitioner, we are a very holistic approach. We look at the patient holistically. We can assess, diagnose, treat, manage, follow up independently. We are an independent practitioner. So I will be there around 11 o'clock tomorrow morning. Great, perfect. See you then. My week's very busy between the outreach and the clinics. So Mondays are my outreach days. That's when I go out into the community and see patients. So anybody that's seen as frail in their home and homebound, I see them in the home. So I get to see them a little sooner, and I can usually get to them within a couple of months. Bob? Hi, come on in. And then Tuesday, Wednesdays, I have clinic here at the hospital, and I see about 6 patients in a day. And then on Thursday, I do more outreach work. My name's Bonnie. I'm the nurse practitioner in the clinic today. Nice to meet you.
Good.
And Dr. Grant is also in clinic. She'll come at the end of the appointment to review everything that we discuss.
Okay.
In the assessment clinic, patients are referred for comprehensive geriatric assessments. So that can be with respect to cognitive decline, functional decline, falls, polypharmacy. Your family doctor sent you here today for a geriatric assessment, and you'll be here with us today for about 2.5 hours. We'll go through all your history and physical and medications and do a bit of testing and a physical examination at the end.
Fair enough.
Great, perfect. When I'm in clinic, the physician referral guides us. So they will ask for the patient to be seen with respect to cognitive decline, functional decline. However, we do a whole overview. Social history, who they live with, are they independent? I can see pretty quickly where I'm going with the patient and what the issues are. I think since I've started working here, our referral basis has increased substantially. And yes, it's patients are getting older and they're living alone. So look at me. Can you raise your eyebrows for me? So hopefully we can get help in the home quickly with our community partners, getting them more supports, more resources, or perhaps advocating for them to move to a retirement home, long-term care. And anybody that I identify vulnerable in the community, I will then follow in the community. I'll do the home visits. Okay, I want to see if there's a drop in your blood pressure. When they come to the clinic, they're dressed up, they're with family, they look great. When you go home, you see how these vulnerable patients are living, and some of them live at risk. It's very hard for me to see.
Did he drive here today?
He did.
And he made it on time?
He did. He made it on time. I have a physician partner, one of the geriatricians that works with me, and at the end of my appointment with the patient, I review with the physician, and then we come up with a plan of care for the patient. If I have any trouble with my patients, I always can rely on my physician partner. So I'd like you to walk to maybe to the end of that poster and back.
Okay.
I work with the regional outreach team, and on that team are nurse practitioners, occupational therapists, social worker, and pharmacy. And it's the same kind of collaborative, interdisciplinary practice. That's very good. I think the program is busy and will only get busier. What impresses me the most is the passion that the people have in my program. We work really hard to provide great care for our patients, and we give 110% of ourselves.
Welcome back to Talk Trillium. I'd like to give a special welcome to David Fry, Vice President Patient Care at the Mississauga-Halton Community Care Access Center. And he's here to talk today about the services that they provide. But first, David, can you tell us what is the Community Care Access Center, often known as the CCAC?
Sure, Patty, and it's my pleasure to be here today. So the Community Care Access Center, we provide home and community care supports to individuals who need assistance to stay at home. We serve individuals from birth to the end of life. And so essentially our role is helping people to live as long as possible and as safely as possible in their home.
And those services are funded by the Ministry of Health, as I understand it.
That's correct. That's correct. We receive funding from the Local Health Integration Network, and oftentimes we provide services such as nursing, personal care, therapies, care coordination to help an individual to be as safe as possible. And those services are all provided by the Local Health Integration Network, which is funded through the Ministry of Health.
Great. And can you describe for me, how do you keep patients healthy at home, and how do you ensure that they try and prevent admission back to hospital or to hospital?
Absolutely. It's so important to help people stay at home and to go back to hospital when they need to go back to hospital. So our core service or support is care coordination, which involves our care coordinator, a regulated health professional, meeting with a patient, a client, and family to find out what matters to them. We work with them and their circle of care, that's often their family doctor, the neighbor next door, to identify how can we help keep you as safe and healthy for as long as possible at home. We put in different services. If people are having challenges in terms of having some stability in their health, we'll often put in nursing or other sort of additional services, link them to other communities, community programs such as adult day programs. Many different services within our region are helpful to help people stay at home safe and for as long as possible instead of going back to hospital.
And I understand the CCAC services are available for anyone that lives in Ontario.
Correct. Oftentimes, Ontarians will travel from one part of the province to another, and so the Community Care Access Center teams from our area and a neighboring area will help support that patient continue their care when they're moving from one part to another part.
Now, you also have a role when a patient is in the hospital. Can you describe what that role is?
Very similar to at home, we work directly with the client, the patient, and the clinical team, so our hospital partners, to better understand what are their needs, establish their goals to help them move safely back home. So we have across Trillium Health Partners as well as Halton Healthcare in our area, we have care coordinators who work in the hospital, linked arms with the clinical team there to help those patients return home safely.
So if I were the patient in the hospital, what advice would you give me about asking the care coordinator when they come to see me? What questions should I ask in order to make my transition safer back home?
So one of the most important things is really helping patients to be informed, to understand who's going to be providing the care, what is the care that you've assessed that I require when I get home, and making sure that you have that information available to you. So the CCAC care coordinator will be in a position after they've met you, better understood what your needs are from the clinical team in the hospital. They'll put in place a care plan, and it's really important for you to understand what that care plan is, what that care plan means, and how can you be part of directing your care once you do return home.
So do I get a copy of that care plan? Can I understand what's in there?
Yes, absolutely. Recently, over the past year, the CCAC introduced something we call the My Story binder. It's a binder that has a lot of helpful information in there information about community resources, so adult day programs again as example, retirement services, as well as your individualized care plan. So that binder is your lifeline, if you will, in terms of your journey in the community.
And what's your relationship with My Doctor? So I have a family doctor,
Yes.
and I'm just wondering, how do we keep all that information together?
Right. It's really important. I think your earlier question around, what can you be asking about if you're a patient leaving the hospital? One of the things that you can be asking is ensuring that the care coordinator is going to share information with your family doctor as well regarding what your home and community care plan is. So the CCAC, when we have a new person coming on to service with us and receiving care, we send a note to your doctor letting them know that Patty is now receiving home and community care in Mississauga-Halton. This is what Patty's care needs are. These are what we're going to be providing in terms of services and supports. And this is who Patty's care coordinator is, should they have any questions. So that's one simple way that we ensure that your family doctor or your primary care provider is engaged. The other is through meaningful conversations. So once you get home, your needs may change. You may settle in fine and have no challenges, or you may have some challenges, some changes in your health status. Our care coordinator would be expected to follow up with your family doctor and help to resolve issues.
Well, thanks so much, David. It's wonderful to know that we have such a strong partnership to help patients both in hospital and at home. It's great to know we've got such a strong partnership between hospital care and in-home community care. And remember, if you have any questions that you would like answered, please send us an email at talk.trillium@thp.ca. Thank you.
The SAGE unit is Trillium Health Partners' new program in implementing best practices in care for the elderly. The unit improves access to geriatric medicine and to an interprofessional team who specialize in geriatric knowledge. Our aim is to restore the functional ability of our community seniors and to get them home as quickly and safely as possible. The SAGE unit is made up of an interprofessional team. On that team includes geriatricians, which are physicians for older adults, nurses and clinical nurse specialists who provide nursing care while on SAGE, physiotherapists who look at the functional mobility and independence for the older adult, the occupational therapist who will look at strategies in promoting activities of daily living, such as toileting and bathing. The recreational therapists look at mental stimulation through play. A pharmacist who will look at medications and management to ensure that there's not any potential dangers. A social worker who will look to help you with your discharge planning and to help you get home safely. And finally, a registered dietitian and speech-language pathologist. They look at promoting nutrition and hydration while ensuring that you're able to swallow and speak well. The SAGE unit is a goal-oriented program. Within the first 48 hours, the interprofessional team will assess the patient and begin to formalize our individual care plan. In this care plan, we focus on 6 clinical areas, which we call the Quick 6. They include bowel and bladder, cognition and mood, functional mobility, medication management, nutrition hydration, and pain management. These are areas that we determined are important for quality of life for the community senior. The SAGE unit is committed at being senior friendly, which means that we keep our seniors physically and mentally active throughout the day. We do this through many activities. One is our 10 at 10, which is 10 minutes of dance and physical activity every morning at 10 o'clock. It's a great way to start our morning. Another way is through our lunch program. This is where we take isolated patients who are in their room and at risk of malnutrition, and we bring them to our communal dining room, where they enjoy their meal as well as a social interaction. Our aim is to keep them physically and mentally active throughout the day so that they have a good night's sleep.
She shares so much in common with everybody in this hospital. And fundamentally, we share one really important thing in common, and that is we are public servants at heart. So please give a Trillium welcome to our Premier.
Everybody. Thanks, Michelle.
You had a chance to go through our emergency department. You can see how busy we are, and the day was just starting. And one of the areas we're particularly seeing an increase, and I know you've heard about this, is mental health. We're just seeing like almost a 30% increase. So when we came through again the hospital and through the emergency department, we know that we're seeing people who are just getting older and more complex issues that they're coming in with.
We need more community care. You know, we need more support for people in their homes. We need to understand how to provide some consistency for people, because I think we'll save dollars, but it will also improve quality of life. We have been working very hard in this province. All of you have been working very hard to transform the system and to keep costs down. And the reality is we've got to have an infusion of investment right now. It's needed in hospitals, it's needed in community care, it's needed in mental health and all of the things we've been talking about.
We talk about why we come to work every day. What's our why? So what's your why? Why do you serve?
I serve because I think we can always do better. Government only exists to do what we can't do alone. Figuring that out isn't always the easiest, and there are still people falling through the cracks. And so until every mom has the support that she needs for her baby, until every senior has the care that they need, then there's work that we have to do.
Thank you, everybody. Thank you so much. Thank you for what you do every single day. Thank you.
Welcome back. Thanks for watching Talk Trillium, and see you next time.